Good evening and welcome to Health is Wealth. This show is brought to you by CAN TV and the Chicago chapter of the National Black Nurses Association. The Chicago chapter National Black Nurses Association meets the second Saturday of each month from 4 to 6 p.m. at the Lutheran School of Theology, 1100 East 55th Street. If you'd like to write us, you can write us at P.O. Box 4612, or if you'd like to call us, you can give us a call at 773-792-7222. I'm your host, Janice Henry. On the phone, we have Reverend Evelyn Collier-Dixon, another member of the Chicago Chapter National Black Nurses Association. And today, our guest is Miss Jolie Holloman from the AIDS Foundation.
Oh, no.
My bad. Well,
No, I sit on the Illinois Getting to Zero Steering Committee,
okay.
Which has been supported through the AIDS Foundation of Chicago, and I did
Okay.
some consulting work with them on the initial. So,
Okay. My bad.
No
Okay.
worries.
So, so it's all important work.
Yeah.
And what we're going to talk about today is getting to zero. And what that means for Illinois, what it means especially for Chicago. We're going to tell you what getting to zero is about and how we plan to get to zero. So thank you for joining us today. And who exactly is it that you work for?
So actually, I'm a community member. I'm a community advocate right now.
Okay.
So my work with Getting to Zero is not affiliated with my organization.
Okay. Okay.
To clarify, they did not sign on. So when I was working with Getting to Zero, it was as a
Okay.
community advocate.
Okay. Well, I met Jolie doing other community work and doing things in Austin. So that just fits right in with what
Right.
you normally do.
Yeah.
So let's talk about getting to zero and what getting to zero means.
So getting to zero means getting to zero, not just getting to zero in the sense of getting to zero when we talk about antiretroviral, because there's a twofold plan with getting to zero if we're going to get into it. So the plan for getting to zero is to increase the usage of PrEP and to increase those who are living with HIV and AIDS to get them into care and into treatment.
Okay.
And so increase the number of people who are in treatment. And so when we talk about getting to zero, it's getting to zero people who are living with HIV and AIDS who are not in treatment, and getting to zero detectability. Really.
Okay. Okay. So is there a plan for how we're going to get to zero?
Well, yeah, that's a part of the plan, is to increase those two things. Increase the usage of PrEP. For those who don't know about PrEP, we can talk more about that as well. So that we're doing things on the line of prevention, but then also to increase the usage of ARV and antiretrovirals for those, and getting those people who need to be in treatment.
So, do you have like a statistic on the number of people? I know that there was a number from 2017, the number of people that were impacted by HIV.
In the state of Illinois, it was over 38,000.
Right.
Yeah, so we have over 38,000 impacted. But still, let me say though too, we've seen a decrease. And however, as we were talking about, and so you're bringing up some of the statistics and the things that were brought up in the recent implementation council meeting, which Illinois Getting to Zero had its first implementation council meeting, which was part of the goal and the framework of Illinois Getting to Zero, which was we came from this framework style of just kind of doing the bare bones of what it would look like to get to zero in Illinois. And again, getting to zero meaning the end of HIV, and getting to zero with those who are living with HIV who are not in care and not in treatment, and getting to zero detectability. So there was this framework of, okay, decreasing are increasing the usage of PrEP and increasing those who are in care. And so there's a framework of this, but now we've gotten to an actual plan that was developed, and now we have an implementation council to implement the plan. So the statistics that you're bringing up were brought up at the implementation council, and they talked about the amount of people who are living in Illinois with HIV. However, we also talked about that there is a decrease in how many people we're finding in the prevalence of HIV. But if we're doing our work, we will find more people. We will highlight more people who are living with HIV who may not be in care, and get them into care.
And so those numbers exactly were like 39,800 and something, and 23,000, close to 24,000 actually live in Chicago.
Yes,
Right.
the bulk of those who are living with HIV and the prevalence, it's heavy in Cook County, in Chicago, yes.
Okay. All right. So, so the plan for helping to get to zero is to increase the use of PrEP.
Well, one of the pieces is to increase the use of PrEP by 20%. So the plan talks about a 2020 plan, which is to increase the usage of PrEP by 20%, and to increase where we are currently. Because right now we're finding that for those who probably would benefit from using PrEP, we may be at around 20%. We need to bring that up to 40% in order to actually reach the goal of getting to zero. And the same for where we are with those who are living with HIV being in care. We would need to increase that number by 20% to reach our goal. Because currently go ahead.
And so what is PrEP exactly?
PrEP is a pill and a program.
Okay.
Go ahead.
So let's say what PrEP stands for.
PrEP is pre-exposure prophylaxis.
Okay.
And it is a pill and a program, pre-exposure prophylaxis, and it's a pill and a program that a person can take and get on the program in order to prevent getting HIV.
So, so that's for people that maybe.
That's for anyone.
What I'm saying is that, let's say for instance, you live with or married to somebody or in a relationship with somebody that has risky behavior, or if you have risky behavior,
Right.
it's to kind of make sure that, well, let's say for instance you're in a relationship with somebody that's an IV drug user, and there is always that possibility of becoming HIV infected, depending on how they use their needles and how they do whatever they do. Or, if you're in a relationship with somebody, male or female, that is in a sex trade, and you're not positive. That's the main thing, that you've tested. And it's important that everybody test, but especially if you're in a relationship or if you have risky behavior, it's important to test.
Absolutely. If you are aware that your partner has risky behavior or you yourself have risky behavior, yes, I would say that seek PrEP. And at the same time, I think those types of conversations prevent a lot of people who would benefit from PrEP getting on PrEP. Because I think of PrEP as something like birth control. I don't necessarily need to know or someone doesn't need to know their partner's sperm count to know that they may have the possibility of benefiting from birth control. Sorry for those. I hope I didn't make anybody uncomfortable. But what I'm saying is a risk is a risk. And to mitigate risk, if you have, it's a conversation that you have with your provider. Each person can have that personal conversation with their provider, just like every woman has, I believe, has the right to have that conversation with their provider about birth control risk. So same thing here. So I think when we start talking about risk and we say, oh, sex workers or this person or that person, I think we talk about really high risk, and then people who may have other risk who would still benefit from PrEP think, oh, PrEP isn't for me, but they may benefit from it.
Well, yeah.
I know. I'm going a different direction.
I'm gonna let it go.
All right.
Okay, I'm gonna let it go.
I'm a
So-
PrEP advocate, so.
Okay, I mean, I am too, but,
And
you know.
especially for women of color. Here, let me say this. PrEP is something that, unfortunately, even at CORE, we had programs that were specifically where we could give PrEP for free to young Black MSM, and we couldn't give it out.
What is
But we had
MSN?
Black men who sleep with men.
Okay.
Black young men who sleep with men was actually the program. Well, it wasn't just for that group, but we were trying to give it to that group because, you know, when we talk about health access, which is another thing that's a part of the program, and making sure that there's health equity involved in this plan, we were finding that a lot of young MSM, young Black MSM, minority YMSM weren't getting access to PrEP. So the goal was, we got free PrEP, let's get it to them. We could not get it to them, but we had people coming from North Side, you know, white MSM who found, free PrEP, who were able to get it through maybe insurance or things like that. And I know in this conversation there's some generalizations, but what I'm saying is, when we, as people of color, don't understand that we could benefit from certain things, we can't even give it away. And now we have Black women who would benefit from PrEP, who think, it's not for me, but it could be for them. And they don't know that it could be for them. So I would like to take this opportunity, too, to say PrEP could be for a lot of different people. And it's a conversation to have with your provider if there's a concern.
Well,
You want to tap
yeah.
my hand?
Okay, I'm not gonna do that. Okay. I'm you know, just gonna say that I'm hoping that that when everybody's having their physicals or seeing their doctors, that their doctors are actually asking them if they want HIV testing and if they want Hep C testing, you know, because that's an important part of it.
Yes.
You know, everybody needs to be tested at least once. I'm going to say every time you go to the doctor, you know, if you're doing like every 6 months or whatever, you know, or even if it's annually, you know, there are just so many people who have never been HIV tested, you know, and everybody needs to be at least once.
Well, and again, that goes back to what we're, and another piece of this is, you know, combating stigma. And so that's what, in that conversation about PrEP, why so many people weren't getting screened for so long was, I don't need to be screened, that's not for me. That's for those other folks to be screened, those other people who have risk or those other. So again, breaking down some of those barriers and saying, hey, be screened. Hey, if you have a concern, talk with your provider about PrEP if it may be for you. Because again, it's not just a pill, it's a pill in a program. It's a consistent thing that you would follow up with your provider about. So screening and all these things are a part of the plan. And integrating it into healthcare so that it is something that providers should be asking about, not just screening, but other pieces of this, not just screening, but also if PrEP is for you, treatment options, things like that.
Yeah, because so many providers just aren't asking anything, you know, and maybe it's that they're uncomfortable with it, you know.
Well, providers are people.
Well, yeah, that's
Providers
that's
are
true.
people.
That's true, but
Practice medicine.
you know, I know in my community that seniors are people 65 and over are the ones that are turning up in nursing homes HIV positive. You know, so everybody needs to be tested. Needs, you know, at least once, you know. And maybe that's something we can work on, going to the senior citizen homes doing HIV testing, but I guess that's for another show or another cause or something.
We could have a whole conversation about that. And that's, again, another part of the plan is to make sure that, you know, for those who are living with HIV, that we're being conscious of those who are, you know, older and making sure that we're linking making sure that we're linking, I think we were talking about that in the implementation council meeting, was how are we utilizing the intergenerational opportunities between those from the older generations and the newer generations, and talking about the new HIV, because a lot of our community doesn't know about the advances in U equals U, which you even kind of brought up too, and making sure that we're combating things like loneliness and isolation and things like that for our older generation.
So, since you brought up U equals U, what is U equal U?
U equals U is undetectable equals untransmittable. So if someone has been undetectable, meaning that they have been taking their medication and have been undetectable for over 6 months, then they are untransmittable, meaning they cannot transmit HIV to their partner.
Okay. All right.
Period.
Okay. So let me ask,
Yeah.
why is any of this important? The whole getting to zero, the whole PrEP conversation, the whole U equals U conversation. Why is it important?
It's important. It's especially important for us because we need to know what's going on. We need to be knowledgeable, you know?
Well, then maybe one other question should be, who's most impacted by HIV?
I mean, so people of color, Black and brown people, are disproportionately affected by HIV, impacted by HIV and AIDS, yes. It's more often that we are being diagnosed with AIDS at the time that we're finding out that we're HIV positive. We're getting the same diagnosis late, and it's my, I don't know if you can quote scripture, but I think of my people perish for lack of knowledge. It's again.
Yes, we quote scripture.
You quote scripture? Okay, so I don't know what the rules are, but I think of just us being empowered by the knowledge of what is happening, and the resources that are available to us. So yes, we have been disproportionately impacted, and even when resources are available, we're too often the last to know that those resources are available. So with the Getting to Zero Illinois plan, it's really upon us who do know about it to make sure that our communities are aware of what is happening, and not in such a way too, because quite often sometimes that messaging has come back to hurt us. I think about when the CDC had a report about like 1 in 2 Black homosexual men will be diagnosed with HIV. I mean, that's not an empowering message. You know what I'm saying?
Right.
So we can also control the narrative here. This is a narrative that doesn't just talk about how we've been impacted. This is a narrative that says we can change how things have been in the past. We have the power now to change the direction of this epidemic and end it, and to change it for us.
Right.
You know what I mean?
Right. And so, what about women?
Black women? Yes, so again, the numbers, so the numbers show that Black women, again, compared to our counterparts, white women are more often, and it's not, and the thing is, it's not just about the prevalence, it's about the numbers of Black women who aren't in care, who are living in not in treatment, not virally suppressed. And these aren't numbers that are just specific to HIV. I mean, because I could be sitting here talking about breast cancer, I could be sitting here talking about a lot of other diseases, because the thing is, we need to, and that's why part of this plan is about linked conditions, because we understand with the Getting to Zero Illinois that when we're talking about HIV, we're not just talking about HIV, we're maybe talking about diabetes, we're maybe talking about other things that are impacting.
Right.
So what we want to make sure that is happening is with this, and I wanted to bring up the WHEELS, which is the plan principles are, WHEELS is the acronym, but it's W, workforce, healthcare, equity, efficiency, linked conditions, and surveillance. Surveillance. But I bring that up to say that, yes, we're disproportionately impacted as Black women as well, but I do believe that this plan is looking, I don't want to just talk about what the negatives of where we are, but the direction of where we're going. And I think this plan is really thoughtful about pushing forward and thinking about how we can build health equity so that we're thoughtful about everybody's not going to just get forward with like this, fairness thing, but we need to make sure that we know that some people are disproportionately impacted and making sure that we target and give more funding and more attention to those who need it. Sorry.
Okay.
I get off my soapbox.
That's okay. It's okay. So who's working on this in Chicago?
There's a lot of people. And it's not just Chicago, because remember, this is the state plan.
Right, it's just a state plan, but, I can only worry about Chicago.
Okay, fair enough. So in Chicago, we have AIDS Foundation of Chicago, of course, Chicago Department of Public Health. There's a plethora of people who are, sorry not to do the paper shuffling, but I don't want to start naming names and miss anyone, to be honest, because there are a number of organizations who are involved and who've been involved from the start, actually. So please go to Getting to Zero. You can actually go to the website, and I should mention this a few times because I want to, if you're not involved, you can be involved, and there are a lot of different ways to be involved. The website is gtzillinois.hiv. If there are things that you're already doing around HIV, or if there are things that you're not necessarily doing around HIV, because the Getting to Zero plan, the beautiful thing about it is it's very comprehensive. So the implementation meeting that Ms. Janice Henry was just on, because she sits on the implementation. She's sitting there very quietly, but she's on the implementation council committee. Okay, she sits there as a representative. It has all sorts of people, right? So you got Department of Human and Health Services and a lot of different people.
But I think, what I wanted to get to was how other people and how other organizations could, could be a part of this plan, because I think we need everybody working on this plan.
Absolutely.
And that other organizations and other groups are welcome to join the plan, or to, join a committee, or, work on a plan.
And that is true. So there are going to be these workforce committees very soon, and so there's also a partner sign-on for Illinois Getting to Zero. So again, if you go to gtzillinois.hiv, you can do a partner sign-on for organizations if you want to come in and show your support. You can also talk about what other things that you're doing that may be beneficial to the plan, and if you want to join a workforce too in the future.
Yeah, because it's all important, but I think what has happened is everybody talks about the opioid crisis, and people have forgotten that HIV is still an issue. Everybody's only talking about the opioid crisis, but we got to keep in mind that that this is as important as the opioid crisis. And we don't need to push this to the back burner.
Well, and then there's intersectionality.
Yes, absolutely. So, any final thoughts on Getting to Zero or anything?
No, I'm really excited about it. I think it's exciting work. I think if you have any questions, if there's anything that we've talked about today that's piqued your interest, or you're like, what was that, or anything like that, please follow up. I don't know if there's a way that they can follow up through you, or...
Sure. You can give us a call at 773-792-7222. You can ask us about any topic that we talk about. Our shows are on YouTube, so you can go to YouTube in a couple days and see this show and call us with any questions that you might have. You can go back and look at shows from a couple years past to see what the topics that we've talked about. And then if you have specific questions, we can link you to the Getting to Zero committee.
And Getting to Zero also has YouTube episodes
Okay.
that talk about this. I
Okay.
did one,
Okay.
and there's a few online.
Okay, very good, very good. So that is a simple way to get your questions answered, and to we're hoping that people will want to join a committee or a work group. This is important work, and everybody needs to be talking about it. I cannot say it enough. Everybody needs to be tested. If your providers aren't testing you, you need to ask for it. I'm going to put it out there, especially if you know that you have risky behavior, or you're in a relationship with someone that has risky behavior. So, thank you, Jolie, for coming on.
Thank you for having me.
You're welcome.
I hope she'll let me come back.
Okay, maybe. Like I said, the Chicago Chapter National Black Nurses Association meets the second Saturday of every month from 4 to 6 p.m. at the Lutheran School of Theology, 1100 East 55th Street. From 4 to 6 p.m., if you'd like to contact us, you can go to our website, Chicago Chapter National Black Nurses, probably.org, and look us up. Or you can give us a call, 792-7222, or our address is P.O. Box 4612, Chicago, Illinois, 60680. And if you'd like to come on the show and talk about something health related, give us a call. Thank you.